Okay, here comes the part that you guys have been asking on the thing when I'm going to speak about wound healing. The reason I speak last is because I got doctors on call. I got doctors that got to go to surgery. I got doctors with girlfriends that had to come. And so I wanted to get everybody taken care of, and I want their stuff to be heard. And it's the basis of how I do what I do. Okay? I do want the mic. I don't think I need it, but then people are texting me, I can't hear you. So I'm going to put it on. Está rojo. Does that mean que está prendido? I would think it would mean that he needs a battery. No. But no. There you go. Is that better? I guess it's better for the life. Yeah, it's quite better. So what am I talking about? I'm talking about what we're doing every day. The basis for what I do. Is there an echo? Am I speaking too loud now? No? Francis, ¿se oye un eco, mi vida? Se oye bien. Gracias, Ángel. So, let me grab my not coffee. Did I already tell you guys that I was in the ER last night getting hydrated because I still have my... I went in and I told Dr. Rio, love you, Dr. Rio, so I'm going to say the story again. I said, Doc, just make sure I don't have an acute abdomen. Make sure I don't have pancreatitis, gallbladder. Hydrate me, let me see my CBC, and send me out. Okay. Well, because I needed to speak, right? So here I am, thank God, I'm fine. I didn't have any of those things. So instead of my usual espresso and black coffee, I'm having hot tea. Unfortunately, I usually have that for dinner.
I had your espresso.
Thank you, mi amor. I'm going to have it here in a bit because I'm feeling better. Okay. With all that said, I cannot do what I do without what the guys do. I cannot impress that upon you guys enough. Dr. Morilla left. I was going to introduce him as our team infectious disease. We work with any practitioner, guys. There's not just these guys. I work with anybody. If the patient already comes with their own ID, I work with them. If the patient is in the hospital and we consult another ID, I work with them. These are just the guys that we group text each other. These are just the guys that if I need an appointment, he's going to get you in tomorrow or Friday. These are the guys that if they need an appointment, I get you in that day. I will drop off the kids and come and open my office for your patient. These are the guys that we do that for. Okay, so that's why they're the team. We have a very good team. Dr. Quintanar, shout out to Dr. Quintanar and to Dr. Semilla, our hospitalist with McAllen Hospitalist Group. Shout out to the Heart Hospital. I'm not partial to a hospital. I'm partial to hospitals that have our protocols established and follow our protocols, and patients heal out and give good customer service. Okay, we'll go wherever. So how do you heal wounds? Let's go on to the next one. I'm going to be brief. I speak very quickly for purposes of time, but if you guys have questions, just text them to me. I'll be happy to answer, and you guys are welcome to interject. What are going to be our learning objectives? Perfusion. Dr. Quintana already talked about perfusion. You cannot heal a patient without proper perfusion. Okay? My brother Ismail Lopez is here. He works with Dr. Sharif Hilmi. I'm going to tell you, I'm going to date me, and I've been saying that I started my practice when I was 2, because I've been doing it 22 years. But you start getting worried when you've been through 3 generations of cardiologists. So I started working, and I knew of the heart clinic with Dr. Hilmi, Dr. Evans, Dr. Blake, Dr. Flores. Those were like the seasoned cardios. And here came the youngins, Dr. Quintana, Dr. Pimentel, Dr. Posada, Dr. Luis Paduri. Right? All of a sudden, Dr. Hilmi is in Harlingen with a group, and we have these youngins that are now the seasoned, and now we have these youngins that is like Dr. Ospurua, Dr. Giraldo, all of those youngins that their face just looks so new and unseasoned. Not uninteresting, Dr. Ospurua, but unseasoned. And I'm like, wait a minute, I've been doing this too long when I'm referring to 3 different generations of cardiologists. And it's an honor because each one comes with their knowledge, and I've learned from all of them, and they've all been mentors. And I have another patient testimonial. Can we feed these people, this family? We're in lunch, and I would love to feed them. I love to feed people. So perfusion, can't do what I do. Dr. Sharif Hilmi in Harlingen does revascularization procedures as well. He's very good at it, very seasoned. And I just wanna give him credit for that and say that very, very important to have perfusion. Non-viable tissue, we're going to talk about that. Inflammation, infection, very, very important. And to Caesar what is of Caesar, right? Let the infectious disease manage the infection, please. I know you're capable. I know you can give your patients some IV antibiotics and get a tissue biopsy and send it and base it on the culture. That's not rocket science, right? But you need to understand that it bogs you down, and there's no way you can manage, and I've tried it. That's why I have a multidisciplinary team. That's why it's evidence-based to use a multidisciplinary team approach to heal. Just give me the wound. Give me the wound. Let me manage my wound. When I have a patient with a wound that doesn't have a primary, they're like, can you also do primary? May I please have one that's room temperature, Damaris? Yes. Room temperature. Can you also be my primary? These are good, mommy. Doctor didn't drink it. Can you also be my primary? Not right now. Not until we heal your wound out. Who's your primary? I don't have one. I've never seen anybody. Okay, not right now. Let me heal your wound. Because to do primary, unless you want to come today for your wound and then tomorrow for primary, because I have to look at all of your wellness, all your fecal local blood, your mammal, your bone density, your hemoglobin A1C, your urine microalbumin. Are your meds right? What do I need to take off? I'm a geriatrician. I need to get you some. Look at your creatinine clearance, your GFR. That is primary care. Look at your psychology. Now I'm very big. I'm working on starting my master's in clinical psychology. I add letters as I see fit based on what I think my patients need. In clinical psychology, this next patient that's going to share with us just moves me so much because we have another testimonial in the other table. And to see them when they walk in, how patients walk in. And I said that we walk in broken. And we walk in what we say in Spanish, desahuciados. And they're like, they walk different. They're in a wheelchair. And they sit there and they're like, me van a cortar la pierna, they're going to cut my leg. I'm like, you're pretty much my last resort, and I'm thinking, I should have been your first resort. Like, why are people referring? These poor patients are coming in with weird drains, and like there's this practice here that people stick drains in things and make like a hole here and a hole here, stick a drain. Like, how is that going to heal your patient, surgeon? Like, surgeons are surgeons, they're not wound healers. So once your surgery is not healing, then you need to refer to a wound healer, right? And so our surgeons that we work with understand that, like, they take care of the wound. Like, we understand, we've let go of the ego, and it's okay that I'm a nurse. Nobody has a chip on their shoulder in my team that I'm a nurse. Certainly the patients don't have a chip on their shoulder because they're healing. By the way, nurses are trained to do wound care since day one of our classes. There is no wound care class for doctors. That is a nurse's job. We touch the wounds, we clean the wounds, we call the doctor and say, Doc, this isn't working, can we try this, can we try that? 9 times out of 10, the doctor's like, write the wound care order, what do I put? I don't know what to put, right? Woundologist is a very new science, it's a 20-year-old science. There's 1,200 for the country. I always say under 2,000. There's 1,200 right now. The board certification is extremely difficult. I took it 3 times. That's the only board certification I've ever taken. Not even my adult gerontology acute care nurse practitioner was that hard. And I was reading CT scans and echoes and EKGs. I hate EKGs, Dr. Sharon Schaff. Now I love them. I'm very good at them now. My brother, I'm like, how do you read that? Okay, it's a science. Not even that board certification was that difficult. Wound care is difficult. Anybody can do wound care. Not everybody's going to heal you. Go to the people that are healing you. How do you know you're healing? Within 2 weeks, you should see improvement. Even not fire wound specialist. How do I have patients coming into my office that have wounds for 10 years, for 20 years? How do I have this? That is malpractice. Give your patient to somebody that can help the patient. Even if you need to refer them to Houston, like find a place. Okay? Inflammation, infection, edema, wound microenvironment, tissue growth, offloading, pain control, host factors. All of these are necessary in order for you to heal. As you can see, a lot of these specialists that spoke are plugged into different areas of wound healing. Okay? So when your patient comes in desahuciado and he's sad because they're going to cut his leg off, and then you look at him, and I tell them, you're going to heal. I've had clinicians say, you need to stop giving patients false hopes. Don't you know that evidence-based says that that's not going to heal? Don't you know that we're supposed to cut it? I heard it at the beginning when I started doing this a couple of years ago. I've been doing wound care for 22 years because I've always done wound care under home health. I used to do wound care on the floor. I always say the story. My hardest wound vac was on a little boy that had a perianal abscess that was very, very deep in a home that was filthy. He had a Child Protective Service case open. I had to do his wound care in a room. He didn't have a bed. He had a mattress. There were dogs and cats everywhere. I had to go in there, double gown, triple glove, mask. Eddie Taz Mercado taught me everything I know about wound care, especially in the home setting. Keep everything clean, sit down on the floor and